One of the most worrying malocclusions is a class 3 malocclusion. That's when the lower jaw grows forward like this. And it always looks unattractive, and especially unattractive on a girl. The current teaching in the orthodontic world is that these are genetic. You inherit them from your parents. There is nothing very much that can be done about it, and children are usually treated by waiting until they're about 18 years old. When their jaws are cut on each side, a section is taken out and the whole jaw is set back. Needless to say, this is a very traumatic and unpleasant operation. What concerns me, and indeed many orthotropists, is that this is a completely treatable and preventable condition. However, it does need to be recognized when the child is very young. And interestingly, the cause is quite simple. It is due to the fact that the patient rests their tongue on their lower teeth most of the time. You can recognize this by looking at the child's face. Interestingly, their lower lip will be slightly thick each side here, because when they swallow like this, contracting that part of their lip. Their tongue is in the bottom of the mouth, and they push it forward. This causes lock-on problems because, of course, if the tongue should be at the top of the mouth but is low, then the upper jaw will collapse, and this makes the problem worse. You have both an upper jaw which is too small and a lower jaw which is too large, and this makes a very unattractive looking face. But I should emphasize that none of these problems are genetic. They can all be prevented quite simply by treating the patient early. Unfortunately, you will normally only find an orthotropist will be able to provide the early treatment necessary to correct these problems. And either way, I would recommend that you talk to your dentist, or if necessary, go to a website to find out what the best alternative is. But remember, the first sign is that thick lower lip associated with a tongue that is very visible when the child is talking.